Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker with Terrible and Home Care. Very glad you're joining us. However you may be joining us, we appreciate it very, very much. And I want everybody to take a second just to think about how important this time of year is. Yes, it's wonderful that it's fall. Yes, it's wonderful that we got some cool weather either here or coming. But more importantly, it is Breast Cancer Awareness Month. It is important for us to think pink. But as we're trying to think pink, it's so very important for us to realize that there's a lot of people out there who need our support. The best way to be able to do that is to be able to connect people with resources and be able to connect people with others who maybe feel like they need someone who's going through a similar experience as them. I am so very excited to welcome this panel to us. First, we have Miss Ashley Harrington. Ashley, thanks for joining us.
Thank you.
All right, we're glad you're here. Next, Miss Alette Martin. Miss Alette, thanks for being here.
Yes.
All right, and next to her is Dr. Jeffrey Rao, whom we got to spend some time with here recently. Dr. Rao, welcome to the show.
Thank you. Happy to be back.
All right. You know, one of the things that we got a chance to talk about, Dr. Rao, is just how important it would be to be able to try and find a way to connect people who have similar experiences. And so let's talk a little bit about the practice and one of the things and why this kind of was important for you to kind of do.
Right. So as I mentioned before, previous segments, breast cancer reconstruction patients are a big part of my practice.
Right.
And they get to know the people in the office pretty well. And the thing about the community is the biggest connection that needs to be made is patient to patient.
Mm-hmm.
To help them share the experience, to help them understand what to expect. So this is part of connecting them, to make them understand that there's a lot out there, and bringing you all together to make this an easier process is important. And, you know, Lillette has been through a lot and has been a person that I've given plenty of patients' numbers to, and Ashley's been through a lot also and currently going through a lot, and it's all about the support, like you mentioned.
Yeah, and we certainly want to hear from the ladies. One of the things that you mentioned to me is that the number of decisions that kind of need to be made, and that's not something that you take lightly, and it's one of those things that you take your time doing and going through, especially with these ladies and gentlemen who need this reconstruction being done. So let's talk a little bit about that process, about thinking through all of those questions and why it's important for them to maybe have a sounding board or somebody else to talk to.
Right, because every patient comes in a different situation. You'll have active cancer most of the time, and then you'll have different routes you can take from there. So it can be complicated as far as what kind of surgery, whether you have a lumpectomy or a mastectomy, or both sides. You either do both sides mastectomy, and if you want reconstruction, or if you're a candidate. So that ends up being the situation that most people come to me with. Mm-hmm. But then there's so many different variations. They can have a patient that needs radiation, that may need to hold off on a certain type of surgery. They may need a patient that has chemo, have to hold off on a certain type of surgery. And as Ashley will mention, she has family members who have gene positive for the breast cancer that may need surgery before you ever even get cancer, because that's the most ideal way when you're higher risk.
Oh,
so
right.
it comes at, you know, in different ways, but you're right. It's nice to have a patient who's been down one route and connect them with another patient to understand, okay, this is the little tricks that I learned. But for the most part, you tend to have some of the similar paths once you get into it.
Right.
So a lot of things are very similar no matter which route you're going.
Right. Once we start uncovering things,
Right.
and once we figure out.
Right.
So, Lillette, let's talk a little bit just about you. I know people very often, and we'll just kind of start this off for this particular segment. Tell us a little bit about your journey and how that process has gone for you.
Well, so when I found my lump, I started the ball rolling, had my mammogram, which I was due for in that next month.
Okay.
But I called my doctor and I did not want to wait because I felt
Good for you.
Absolutely. And you know, part of me and Ashley's reason for being here is for the answers to the questions the patients have that the doctors can't give you. And your mind plays such a big role in how scared you are about what is to follow once you get diagnosed. You know, like trying to figure out, am I going to do the lumpectomy? Am I going to do the mastectomy? Am I going to do a double mastectomy? And then going forward with it. finding a doctor you're comfortable with, which the Rows made it so simple. They were very comforting, very assuring, which is what you need when you're going through cancer. So we did it very quickly, luckily,
Okay.
but I know it's not that easy for some women. And that's what we're here for. If you need us, give us a call because we can tell you that it's not as bad as your mind makes it out to be.
Yeah, some of that anticipatory anxiety, right? Just hearing the C word, it's one of the things that we talk about so very often. You hear the word cancer, and like Dr. Rao and I discussed, sometimes you can't really process anything else right away. So as we kind of wrap this segment up, tell us when that was for you, when you got diagnosed.
I found my lump in October of 18,
Okay.
and I had my double mastectomy in November of 18.
Wow. Like
Yeah, it
you
was
said.
very quick.
Yeah,
very
and
quick.
so like Dr. Rao has described, sometimes that takes a lot of evaluation, and we can sometimes do that quickly, sometimes not. But it was about the process that you went through, and we appreciate you sharing your story. Kind of talked about how you've kind of gone through the process a little bit, and actually you're kind of just starting
Yes.
this process. Tell us a little bit about your journey and how that's happened.
So my journey started in March. I was diagnosed at the end. I actually did not find my lump myself. My doctor did upon my wellness visit. I cannot stress how important those wellness visits are.
Okay.
Once my lump was found, I was diagnosed within 1 week.
Ooh.
Had to go get several mammograms, MRIs, things like that. Had my surgery, my double mastectomy and deep reconstruction at the end of May. And then in July, I want to say I started my chemotherapy process, currently doing that right now.
So in the middle of chemo, and so it's been kind of a whirlwind, right?
Yes, very.
Can we talk a little bit about what happened, like that wellness visit? It's interesting. We go in for a wellness visit, right?
yes.
To see how well we are.
Right.
And you came out of that with, oh my gosh, I have a lump.
Right.
Can we talk about that process a little bit, about maybe what you were thinking and
Yeah.
and what maybe some of your concerns might have been?
Yeah, absolutely. So I just went in for my normal yearly wellness exam,
Right.
and that is where my practitioner felt a lump. And then my mother actually had breast cancer, passed away from it. So that was my first concern. Am I going to end up like my mother? It was very scary, absolutely. But with the care of the doctors, I cannot thank them enough that within 1 week, I knew I had it, and it was gonna get fixed. We were gonna be okay.
Wow. So, ladies, both of you have kind of described a scenario where things can move pretty quickly.
Yes.
And I think it's one of those things, and Dr. Rao alludes to it pretty often, about that team approach, about being able to address things. So, Dr. Rao, it's one of those things where you're one of many specialists and subspecialists, if you will, to address those things. Can we talk about how that happens so quickly sometimes?
Yeah, the the comprehensive program of having so many physicians involved is important, and that's what I represent all of those physicians up here, because everybody together is helping take care of the problems and diagnose and work them through the process. Most of the time, it's going to be your wellness physician, your OBGYN, your primary care doctor, that will find things and find the imaging that has a suspicious mass, and then progress from there to the surgeon. Most of the time from there, we try to get, depending upon the situation, but most patients will get presented in front of the tumor board, which is every Thursday we have, and we meet, every specialty comes together, and we talk about every patient and talk about the plan, because everybody does have their little bit different scenario and different situation, how aggressive the tumor may be, if it's in the lymph nodes, what's their age. There's a lot of factors that are involved. So it's very important to have everybody come together to make that decision. And then it progresses from there. So, you come up with the best plan, the best next step, whether you need chemotherapy before or after your surgery. So there's a lot of little things that go into it.
Right, and it's good to have the members of that tumor board together, being able to really discuss those cases. And so, for you, it happened pretty quickly, but it wasn't always so easy. There were a few bumps in the road, right?
Absolutely. So when I started the process, I did the double mastectomy. Then you have to wait, because back then, Dr. Rao wasn't doing the flap.
Okay.
And then he gave me the good news he would be able to do it. So I was so thankful that I could stay here in Terrebonne Parish and go to Mary Bird Perkins in our community and help out, the people here. And so we did the mastectomy, everything went well. And then about 3 weeks into it, I developed fever.
Okay.
Called Dr. Rao, and I said, I don't know what's wrong, but I'm crying and I don't feel good. And he goes, come in and see me. So long story short, we had to remove the expanders. And then that was the real deal. I come home and I look like a cancer patient. There was nothing there. They had to remove one of my nipples. It was a very emotional time, but we got through it. I had a great support system. He was wonderful. Every time I needed him, he was always reassuring, and just making me realize that one day it would be in my rearview mirror. And it was. And now I look back on those things. And then we get to the DIEP flap, and that went well. But of course, my body was being ugly again. There was some bumps, but again, anytime I needed him, he came through. My body started to start behaving. And then we went forward, and now it's 4 years. Everything's great. And
The biggest thing is
Here
you
we
don't
are.
wake up any day thinking, I'm a cancer patient, or see a
No,
cancer patient in the
no.
mirror. That's the biggest thing that we try to help with patients, is to try to say, you got the rest of your life to live. You don't need to wake up every day and have a reminder it's something that took away what made you a woman. So it's a big
absolutely.
point.
Yeah,
Really big
And
point.
people have to realize that when we are chosen as those cancer patients, in life, that we want to be women again. The DIEP flap is not about being bodacious by any means. It's just about being normal.
And this process is about normalization and feeling like the woman that you're meant to be.
Absolutely.
And I love that we can do it. You, Dr. Rao, it's important that we find a way to support people and that they have an access point. And you've been wonderful about wanting your office to kind of be that and available for that.
Absolutely. We have the office there all the time to call and relay messages to me, and even come in and see the office staff if I'm in surgery. But the next step beyond that is the support from other patients. So as much through the COVID years and stuff, it's been a little difficult bringing people together.
Right.
But we're trying to bring that back out and go beyond just, hey, let me give you another patient's number. Y'all contact each other, and I've connected patients over the years that way. But bringing them together into a physical connected space to be able to really see the person, understand their story, and it really helps out, I think, more for the whole process.
Yeah, and so, ladies, for you guys, it's really important that I've kind of heard how similar situations and yet still very different, but being able to talk to somebody about what maybe some of their fears or concerns are. I think that's the importance of being able to kind of do this one-on-one for those people that need it, but also having that larger support system. And so it's been something that's been really good, right?
Yes.
Knowing that may be available to you to talk to somebody, because people are different in how they respond. Some people want to talk about it and share their story, and some people would kind of prefer to do that one-on-one, right?
Right.
And so having that available has been pretty important. So Ashley, just for you, would you want to do that? Want to talk with somebody, or would you want to be able to kind of share that in a group? What would be your perspective on that?
I guess it would honestly depend on which day. Some days I'm like, I'm more reserved, one-on-one, and then some days I want to hear everybody's opinion. I want to talk to everybody. I want to hear anything and everything somebody could give me, advice, everything. So I guess it would just really depend on the person. Like they say, everybody's different, every cancer is different, every person is different on what they would want in that perspective.
I love it. So it kind of gives us a format about how to be able to do that. So Lillette, for you, that you've kind of done this for a little while, you're a little bit of a champion in a different way, right? So you've been able to do this for some time, and you've been able to wear it well, if you don't mind me saying, because since you've overcome some of those bumps, it's obvious that you've got this joy and this peace about the process and the journey.
You know, I believe that as patients, her and I can give the things that doctors can't. You know, like I said, my mind was playing so many tricks on me, trying to figure out, okay, how do I do this? How am I supposed to react? You know, and when I was diagnosed, I really didn't know anyone that had it. But then since I got diagnosed, lots of my friends, unfortunately, have gotten the diagnosis as well. And they'll call me and we'll discuss it. And we'll say, okay, this is how I'm feeling. And then they might give me a better perspective than my mind is, you know? So in that aspect, I think it's a great thing if this parish can come together and get us people that are diagnosed with whatever, whether it be breast cancer or any other unfortunate situation you may find yourself in. And so lots of people will call me, well, what do you think about this? And I said, look, before we go any further, just know, even though we're both breast cancer people, our markers might be different. Things may have to happen differently, but it's still the same thing we're fighting for, to get healthy.
Right.
Because that's what it's about. It's really not about anything else. It's about keeping your mind healthy first, and the rest just comes along.
And being able, and you made a really important point earlier about not feeling like a cancer patient, not waking up every day and feeling like a cancer patient. And for women, being the woman whom you were meant to be, no matter what it takes to get there, is something that Dr. Rao and his team have really cared a great deal about, making sure that letting you know we can get there. And that you won't have to kind of wake up and get that feeling. And that's kind of what reconstruction is about. But it's also about reconstructing us emotionally, psychologically, as well as physically.
Exactly.
Okay.
And you know, the care that you get, like they were so positive all the time.
Absolutely.
No matter, even if it was a negative thing, you know, even if you got a little infection, okay, we're going to give you a little medicine.
We'll get
or
through it.
We're going to get through it. Exactly.
And quite frankly, I think that's the theme here today. We're going to find ways to help people get through it, even if it's one-on-one with direct contact with the peer support specialist. If it's in a larger group setting like a support group is, we're going to be there. And so this is our commitment here in October for Breast Cancer Awareness Month, through Dr. Rao, through people like yourselves, that we're going to be here for each other. We're going to be here for our community, and that we're going to be able to fight this fight together and be able to do it in a positive way. Right?
Absolutely, because we are ultimately stronger together.
Yes, we are. Yes, we are. Ashley, thank you so very much
Thank
for
you.
coming on and spending some time with us. And we'll be thinking about you. We'll keep you in our prayers as
Thank
you
you very
process, because chemo here,
Yes,
right?
I'm actually going this afternoon for another treatment.
Wow, here we go. Chemo today.
Yes,
right?
today.
Very good. And Lillette, for you and really being able to kind of your passion for this journey for other people that you've shared. Thank you for doing that. And
Thank
we
you for
appreciate it.
having me.
Absolutely. And Dr. Rao, we can't thank you enough for really having the vision to see this and move it forward.
Yeah, I'm happy to help in any way I can. You know, it's you see the process for everybody, and it makes you feel good to watch each person kind of work through it. It's very satisfying.
I love
to
it.
work through the process.
Thank you so much. People can reach out to you or I, and we'll be able to give them more information. All right, guys, that will do it for this particular segment. Don't go anywhere. Let more value time when we continue.